Hello guys, welcome to this new video on inflammation. Today we'll focus on the vascular events of inflammation. So inflammation has two main events, the vascular events and the cellular events. Alright, so you can subscribe to our YouTube channel, like this video, share it, and don't forget to turn on the notification panel. Alright, so we'll start with the definition of what is inflammation. Then we'll move to the causes of inflammation, the goals of inflammation, the cardinal signs of inflammation, and we'll end this video with the inflammatory process. Alright, so what is inflammation? Inflammation is simply defined as the local response of living tissue to injury, alright, due to any agent. Again, inflammation is defined as the local response of living tissues to injury due to any agent. So these agents, they could be infective agents like bacteria, viruses, parasites. They could be physical agents. It could be mechanical trauma. It could be radiation. It could be heat. Alright. They could be chemical agents like poisons. So what are the goals of inflammation? There are two main goals of inflammation. First, to eliminate or limit the spread of the injurious agent, and then to initiate tissue repair. Now, there are some characteristic signs that tell us that this is an inflammation. They are called cardinal signs of inflammation. So there are four main cardinal signs of inflammation. The first two, pain or dolor, then swelling or tumor. They are due to changes or increase in vascular permeability. The next two, we have redness or rubor and heat or color due to vasodilation. Alright, so at times some people add a fifth cardinal sign, which is loss of function. So how do all of these signs come about? How does this pain, this swelling, this redness, this heat comes about? So let's look at this in the inflammatory process. Alright, so here we are looking at blood vessel right here. This is our blood vessel. Alright, okay. So this is the tissue, our tissues, okay, and this is the interstitial space or interstitium. So this is our agent, our injurious agent, a bacteria, for example. So once these bacteria gain access into our system, they have some surface antigens. All right, so these bacteria can release endotoxins. Now these endotoxins can be recognized by resident cells of our connective tissue. They are called mast cells. All right, so mast cells have a group of receptors which can recognize these endotoxins. So once these endotoxins are recognized by the mast cells are activated. So once the mast cells are activated, they undergo a process called mast cell degranulation. So they release their granules, and these granules contains powerful inflammatory mediators, mainly the histamine, prostaglandins, leukotrienes. Alright, so these endotoxins released by the bacteria also damages our tissues, okay? It also leads to tissue damage. So now the body doesn't want to lose these phospholipids. Remember, tissues are made up of cells, and cells have a phospholipid bilayer. Alright, so a cell membrane is a phospholipid bilayer. So once this endotoxins damages our tissues, okay, so there's a molecule, an enzyme called phospholipase A2. So this phospholipase A2 is going to convert our phospholipids, okay, into arachidonic acid metabolites right here. So as we can see right here, this is our phospholipase A2. It's going to act on these phospholipids and convert them into arachidonic acid. So from there are two pathways. Arachidonic acid can be converted by LPO lipoxygenase into leukotrienes, or the arachidonic acids can be converted by COX-1 and COX-2, stand for cyclooxygenase 1 and 2, into prostacyclin, prostaglandin, and thromboxane. Alright, so let's look at how these cardinal signs, this swelling, pain, redness, heat, comes about properly. Alright, so we are looking at the tissues right here. So this is our blood vessel, okay, So these mediators, these inflammatory mediators, histamine, prostaglandins, leukotrienes, they cause change in vascular permeability. How? They stimulate the endothelial cells of the blood vessel. These are endothelial cells. They stimulate them, causing their contraction. Alright. So once these endothelial cells contract, leads to many gaps in between the cells. Alright. These gaps allows leakage of fluid into the interstitium. So what's that called? Edema, right? So leakage of fluid, accumulation of fluid into the interstitium will lead to swelling, or we call edema. Alright, that's the first sign. Okay, so what are these guys right here? What are these two guys right here? Okay, they are called nociceptors. Nociceptors or pain receptors. So once this fluid that has escaped from the blood vessel accumulates in this interstitial space, the swelling compresses these pain receptors, leading to the sensation of pain. So we have seen two cardinal signs, swelling and pain, due to changes in vascular permeability. Let's look at the next two signs, redness and heat. So the next two signs, redness and heat, will be due to vasodilation. Alright, so we have two blood vessels here. Here you can see the lumen. This is before vasodilation and this is after vasodilation. So you can see that the lumen here is enlarged. So the inflammatory mediators, histamine, prostaglandins, leukotrienes, they cause relaxation of the smooth muscle in the tunica media of these blood vessels. Once the muscle relaxes, the lumen increases. Alright, so increase in the lumen will lead to increased blood flow in that area. Okay, it's called increased blood flow, local hyperemia. Alright, so when there is increased blood flow into this area, it's going to cause redness, right? It's going to cause redness, and remember that blood is about 37 degrees Celsius, 38 degrees Celsius. That's kind of hot. That's what is going to cause heat. All right. So those are the two other cardinal signs, heat and redness. They are due to vasodilation. So what is the purpose of vasodilation? What is the purpose of increased vascular permeability? Why does the body does that? So right here, we are looking at our blood vessel that's been vasodilated. All right. So vasodilation allows increased blood flow into that area. All right. So increase cells into that area. All right. So there are some resident cells in our blood vessels. Like, let's consider this is a monocyte, for example. It's circulating freely into blood. There's receptors for the P and E selectin of the endothelial cells. So once these monocytes bind to these E and P selectins, okay, they undergo a series of processes that will enable them to reach the inflamed area or the site of inflammation in order to get rid of this bacteria. So what happens is that once they adhere, they perform rolling, okay, tight adhesion, emigration, or typedesis. So the increased vascular permeability will allow these blood cells to deform and squeeze out of the blood vessel. It's called emigration or typedesis. Now, after that, they will undergo directed chemotaxis. So these chemokines, these cytokines, will attract them to the site of inflammation, permitting them to phagocytose the bacteria. All right. So this is a process right here: adhesion, typedesis, and then phagocytosis. All right. So most of the times in our body, in our systems, once these blood cells undergo phagocytosis, they kill the injurious agent, they kill the invading microorganism, but they are also destroyed in the process. All right. So it's a rolling, adhesion, typedesis, phagocytosis, and then destruction. The destruction is the bacteria alongside with the macrophage. All right. So once this macrophage is destroyed, as we can see right here, he can't combat, or he can't destroy other circulating bacteria. All right, so he's going to call for help. And how does he does that? He's going to release tumor necrosis factors, interleukin 1, interleukin 6. All right, so what are these molecules going to do? Right here. So this is our interleukin 1, 6, and tumor necrosis factor alpha. So first, they will act on the hypothalamus, that's the thermoregulatory center of the hypothalamus, and cause fever. So fever is a mechanism put up by our body to enable fight infections, because at higher temperatures there are some microorganisms that are inhibited, or at higher temperatures there's increased metabolism that permits us to fight off the infections. So these mediators released by the macrophage also act on the liver and cause the release of acute phase proteins. All right, so like C-reactive proteins. So once a doctor sees an elevated blood level of C-reactive proteins, is a sign of acute inflammation. All right, so this tumor necrosis factor interleukin 1 and 6 also acts on the bone marrow to stimulate the production of more of these cells to combat the infection. So in a nutshell, that's the vascular events of inflammation. Thank you guys for watching this video. You can subscribe. Don't forget to subscribe to our YouTube channel for more videos. See you later.